things that happen to have a diagnosis when you have celiac disease. Today we're going to be talking about Sjogren's syndrome. Sjogren's syndrome is an autoimmune disease where people's white blood cells attack their moisture-producing glands. It's characterized by the inflammation of the lacrimal glands, probably said that wrong, the glands which produce tears, and the salivary glands, including the parotoid glands, which produce saliva as well. Here's some hallmark symptoms of Sjogren's syndrome. Dry eyes and dry mouth, but also change in sense of taste, chapped lips, difficulty chewing and swallowing, dry cough, dental cavities, enlarged parotoid glands, which are found in front of the ear and behind the jaw, fatigue, fever, gum disease, hoarseness, irritation in the nose, joint pain, lung infections, mouth sores, and oral yeast infections, and rashes and dry skin. Aside from the glandular issues, there are extraglandular problems associated with Sjogren's, such as arthritis, Raynaud's phenomenon, lung inflammation, as well as kidney, muscle, and nerve disease. Although rarely seen, Sjogren's patients can also experience inflammation of the blood vessels. So what population does it affect? It affects upwards of 4 million Americans, and 9 out of 10 of those are women. Also, Sjogren's, what does this have to do with celiac disease? Basically, they're both autoimmune diseases, and when you have celiac, your propensity for developing other autoimmune diseases goes way up. As I just was reading, that if you're diagnosed in your early childhood, I think you have a 10% chance of developing another autoimmune disease, whereas if it's in your 20s or later, your chances of developing another autoimmune disease go up 30%, maybe I think 34 specifically. Also, there are a lot of shared symptoms: tooth decay, mouth sores, skin rashes, dry skin, and recent findings in Sjogren's have discovered that 4.5 to 15% of those with Sjogren's also have celiac. And again, 1 in 133 people have celiac. So if you have Sjogren's and you are experiencing some other GI symptoms or not, celiac can be completely asymptomatic. It would be worth just saying at your next checkup to ask your doctor for the celiac test. Just bring it up with him, maybe discuss it. Again, I'm not a doctor, but it's always good to have this information out there to make sure you are your healthiest person. So thanks so much for watching. As always, it's from Have Not to Have and gluten-free dining and life, for that matter.